All right. Hi, Barb. Welcome to the
Hey.
Rule Breaker Studio. I am so privileged to get to know you and have gotten to work with you on the pub committee with AONL for the last, where are we on 2 years now? Is
Yeah, I
this
think
year
we're
two?
going into year three. Yeah.
Oh my gosh. Okay, that went fast.
Yeah.
So I'm so excited to get to share you and your views and your thoughts with our listeners today. So I really just want to jump right in. I'd love for you to share just like about yourself in general, maybe a little bit about your career, and then if you would just kind of dive into that love and passion that you have around nurse executive well-being. I'd love for that to be a pivotal part of our conversation today.
Sure. And thanks for having me. I'm really excited to be here. Any opportunity I have to talk about chief nursing officer well-being, I'm going to grab onto it, especially with two great folks like you. So thanks for having me today. I am Barb Seymour. I have been a nurse for almost 30 years, which feels really weird to say. But I've had the privilege of serving in the profession for 3 decades and currently work with Vizient, which may be an organization that some listeners aren't familiar with. So we are the nation's leading performance improvement company in healthcare, which boils a whole bunch of stuff down to one really powerful statement. And as part of that work, I have the privilege of leading a network of over 700 CNOs in thought leadership, collaboration, and really just the opportunity to radically transform healthcare and the nursing profession. That comes after 10 years of serving as a chief nursing officer in a variety of settings. So I really view my job as the opportunity to help make the lift lighter for our chief nursing officers as they serve their staff, their patients, and their communities in the work that they do. And so part of that really just gave this fertile ground to exploring chief nursing officer well-being, which is a passion of mine. I served as a chief nursing officer, as I said, for a decade prior to joining Vizient, but part of that time was during the pandemic, which was, as we all know, an unbelievably stressful time, and that doesn't even give justice to what we experienced. And through the pandemic and coming out of that, I recognize now in retrospect that I was experiencing my own significant level of burnout and fatigue, unrecognized by myself at the time. I imagine unrecognized by those that were around me. And so it created this experience that has left an indelible mark on me, but also has given me this passion to make sure that we prevent that level of burnout in our chief nursing officers, because they set the standard for everybody that works in the nursing enterprise. And part of this work came from just some curiosity. We've heard a lot about frontline nurse well-being. We've heard a lot about nurse manager well-being. Those are very important areas to focus on. But as we started to ask some questions and do some inquiry, there's very little that exists in the literature that talks about chief nursing officers as their own unique subset of nurses and caregivers and addresses their well-being specifically. So I was very privileged to be able to conduct some work through the Nurse Executive Network earlier in this year to explore those mediators of burnout, the impact of those on our chief nursing officers, what they do to invest in their own well-being. Frankly, it's what they don't do to invest in their own well-being, and just ask some questions about what can we do more, better, or differently, which everyone will tell you is my favorite question in the world, to make sure that our CNOs are well. There's so much turnover and churn in the C-suite, particularly with chief nursing officers. It creates this whole cascade of impacts to the organization that also really aren't heavily researched or talked about. So I could probably do this work for the next 10 years of my career and not be bored and be super happy to make that kind of impact. But that's just kind of the tip of the iceberg of what we've been able to do.
Okay, so I want to thank you for sharing your own like vulnerable story, because I know it can be hard, when we're talking about our own experiences. I actually got chills thinking about my experience as a nurse executive during the pandemic, as well as leading an ED with a newborn at home. And the only ED for like miles and miles in rural Kentucky with 100,000, patient visit volume. And so it was very, it is very eye opening. And I think that was really the same pivotal moment in my career to say, like, is this where I want to be? Is this what I want to do forever? And really has been part of, the whole journey, right? Like finding things that help us to find joy. So with that, I do have a question for you. So when you're doing this research and you're doing this work, what would you say has been the most like eye opening thing that you've found in talking with other CNOs across the country and other nurse executives as you're looking at how do you manage or how do you understand their well-being or lack thereof?
Yeah, it's a great question. I think one of the most eye-opening and sobering things that we learned, we asked about what are the things that you do to invest in your own well-being, and how often do you engage in those activities? And there's been this, what I'm going to call a normalization of deviation, where things that we would probably identify as the normal course of life, like spending time with our families, taking time off from work, have become these discrete activities of well-being in the mind of the chief nursing officer. So there were these categories or themes of well-being activities, and about a third of the chief nursing officers gave responses like, I try to spend time with my family, I spend time with my husband, I try not to work when I take PTO. Coupled with that, we asked, how often do you engage in these well-being activities? And again, a third of the respondents, and we had about 105 chief nursing officers that responded to this survey, about a third of them gave a response of 1 to 3 times a month or rarely to never. So you start to fill in those blanks, and it reads like, I spend time with my husband 1 to 3 times a month. I spend time with my family rarely to never. Mm-hmm. And when you start to fill in those blanks in that way and think about what our CNOs are doing in the course of their work and their service, that just, to me, that's heartbreaking. And it's no wonder that we have such burnout and fatigue among our chief nursing officers. One of the other things too, we asked about these 5 mediators of burnout: moral distress, moral injury, compassion fatigue, secondary trauma, and leadership fatigue. And of those 5, secondary trauma and leadership fatigue really emerged as the 2 most prominent mediators of burnout for the chief nursing officer. And so these decisions that the chief nursing officer has to make from a place of moral courage then creates trauma from those decisions that they have to make. And I'll give you an example. In my last CNO position, and I was in a non-urban hospital, we had to make the tough decision to close our labor and delivery unit. That impacts the community, that impacts the staff. Those are not light decisions to make. You don't wake up one day and say, hey, I'm going to close a service to the community. But seeing the reaction in my nursing staff, hearing the reaction from the community, we take those things very personally and very seriously. And so that's just an example of how those tough decisions that the chief nursing officer has to make can create their own, kind of scars and trauma that they have to deal with and incorporate into who they are and how they carry forward, both personally and professionally.
Gosh, you've said so many things that have made me excited to dig a little bit deeper. I'm so passionate about caring for the leader, and I'm grateful for the work that you're doing. What you were saying about the well-being and them caring for themselves, I'll tell you, the majority of my work is around frontline leaders, so managers, directors, charge nurses. But I have spent a reasonable amount of time with executives, and the vulnerability is a little less. And I've mentioned this before. I see the tears come. It's the regret of missing out. And you're trying to be everything to everyone, but what they really miss out on, what comes second, is the family. Marriages suffer, kids are grown and they've missed out. And then they come last. And this is not new, although I think back to when I first entered into leadership, nobody had a cell phone in their pocket where they're constantly connected. That has definitely changed. So that's one thing I wanted to dig a little bit deeper on is just, I love appreciative inquiry. So what's working? Who's nailing it? And what are they doing that's different and still being able to maintain? Have you put your finger on that yet?
Yeah, fantastic question. And I think you've teed up the answer as part of the question. So interesting. I had the privilege of sharing this work in a little bit of a deeper way with a few different organizations and their nursing leadership teams. And I went to a conference and saw one of those CNOs where I'd had the opportunity to share this work and really challenge them to think about their own well-being and what they're doing. And she told me that she went for a week vacation. She didn't check her email. She turned off her notifications. She had a backup plan for coverage so that she didn't need to be bothered. She said, it's the first time I've walked away from work since I've been a chief nursing officer. Years. First time she's truly disconnected from work. I said, did the place burn down? Did things fall apart? She said, no, they didn't. And now I know I can do that. So it's really just finding the courage to take that first experience and know that the building's not going to burn down and things aren't going to fall apart. You have this group of people around you to be able to fill in that gap so you can take that time away to invest in yourself and refill your own cup. So I think just taking that first courageous step to disconnect and have that experience of it's all okay and I can come back to work refreshed and ready to hit the ground running again.
Oh my gosh, you nailed it. And those people, they want to be empowered. They want to grow that skill set. They want to be trusted.
That's what I was going to say. They want the trust. The trust is, you just have to give it. You have to instill it, and they will rise to the occasion. I wholeheartedly believe that.
They will.
Yeah, you have to set that example too. Like when we think about succession planning too, it's no wonder that nursing leaders are looking at the chief nursing officer like, man, I never want that job. Look at what has to happen. I had one chief nursing officer that described his relationship with the house supervisor as pathological because they were just in constant communication. Like he felt like he could never step away. And so people see that and they're like, I don't think that's the place that I want to be in or what I want to aspire to do. And so this is just as much about investing in the future of nursing leadership as it is in investing in ourselves and our own well-being.
You lobbed me the perfect softball for the next thing that I had on my mind. I love it when that happens. That succession planning. So we're building them up, we're preparing them. And what I see a lot, you mentioned the C-suite turnover, and I'm seeing a lot of chief nurses go into the role having never done it before. There's not a lot of things out there that prepare you in advance of getting the role. It's now you're in the role. Now let's equip you. And they're unprepared for all the things that come along with it. The relationships in the C-suite, what you really have influence and control of. Control is probably a tough word. And then all the things that happen with constant social media in your face, and we're digging, right? You mentioned the tough decision to shut down a whole service, the impact that has on you. I see that a lot with unions when nurses go on strike. And gosh, that feeling of I'm left here to deal with this. And then when they come back, want to be welcomed with open arms. It's like the nurse leaders I see really do care. They lose a lot of sleep over these decisions. They lose a lot of sleep over these things. And that dig of, oh my gosh, they're giving us another pizza party, when really they're doing everything they can to just try to make it a healthy place. And I just wonder if there's anything that you know of that's working well to get these people prepared, or if we were to create something, what that might look like. What do you wish you had before you were a CNO?
Oh gosh. Well, definitely a lot more preparation. And I think one of the things that we don't do well, we don't begin with the end in mind. So, I always joke about, I remember when I took my boards a long, long time ago, and I got my letter in the mail that said, congratulations, you are minimally competent to practice nursing in the state of Kentucky. That's exactly how it read. I will never forget that. And we have to prepare clinicians to take care of patients, right? But I remember as a leader, it was kind of like pulling back the curtain. And I was like, this is why we do some of the things that we do, that from my perspective, being prepared as a clinician seemed really wonky. But now I'm starting to understand why we do some of the things that we do. And I think we kind of shoot ourselves in the foot by not beginning with the end in mind. Why are we not preparing nurses to understand the business of healthcare while we're preparing them to take care of patients? They need the entire picture. And so I think we got to back way up in the process. This isn't just about making the leap from director to CNO. This is about a foundational education and preparation in the business of healthcare and the complete picture of what we do and how we serve.
Okay, you're talking my language, because I know I'm very passionate just about like communication and nurses understanding like healthcare finance and things like that. I think is a huge gap, even just coming out of nursing school, right? Like you're not understanding, you get frustrated at the bedside because you don't understand why these decisions are made, at whatever level they're made at. And I think that is the huge gap in communication. And it's why we see such a rift in being able to maintain optimal workforce, right? Because we have poor communication. Well, it's also because they're not understanding each other's language. The clinician is not at a state to talk the language of the leader, and the leader is a little bit far removed from talking the language of the clinician. And so I think that's huge for me. I am big about how do we figure out and how do we bridge, and what are strategies that we can provide leaders with to be able to effectively communicate on both sides. And I do agree. I think we have to do a better job of educating all of our clinicians on what it means, what do the finances of healthcare mean, and how do they affect us? Because we all want to cash a check. I've been making the joke that it's check cashing season, but it's true. Like it's always check cashing season. Like people want to, you want to make sure that you have stable employment so you can care for your family, but not understanding the finance aspect of it in healthcare is really a challenge in communication and being able to make sure that we're all taking care of patients. That's all of our goal. But we can't do that if we can't communicate.
Yeah.
I think that causes such a huge gap. So I'm privileged to hear you talk about that and know that that's kind of like the trend that's across, our executive leaders as well.
Yeah. And what a fantastic opportunity for us, right? Because nursing process can be applied to every aspect of healthcare. When I would talk to new nurses that were coming into the hospital, or I would talk to student nurses, I would tell them, I am still a nurse. I apply nursing process to one very large, very complex, most times critically ill patient, and that is the healthcare system.
Yeah.
You still have to understand which systems are not functioning optimally. If I tweak something in this system, how is it going to affect another system? This is the same as complex patient care. You have to create a care plan. You have to know who to consult. And then you evaluate outcomes, and you have to ask, okay, what do I need to do differently to optimize the health of the organization? So if we could frame healthcare business and finance through the lens of nursing process, that would be a huge game changer. Huge.
I'm totally stealing that when I am talking to people. I give a lot of examples from being a clinical nurse because we can speak to that. That is such a great example of it's a critically ill patient.
Yep.
Oh, the systems level thinking that came along with that was just gold.
Awesome.
Thank you.
You're welcome.
Okay, there's Barb's golden nugget for the day. Okay, so we are coming to the end of our conversation, and we do have one key question for all the rule breakers out there. From what I am gathering, is a pretty strong rule breaker herself. So, Barb, if you could break any rule in healthcare, what rule are you breaking?
So I think there's already some work that is starting and some groundswell around this, but I would love to break how we measure nursing value and how we do that at the professional level, the organizational level. I talk a lot about productivity, which is supposed to be a leading measure for how you're going to meet your budget, but really has become like the tail wagging the dog. It's the standard of what people are looking at without thinking about new care delivery models. And I might bust my productivity, but if my labor spend is better and my clinical outcomes are better, then I've hit the mark.
Yeah.
So I'm not sure that we have revolutionized healthcare finance anytime recently. I mean, I can't recall anything. I can't find anything. And maybe those are still the right measures. Maybe we just need to approach them differently. But I would love to be in or find some really radical, just let's go after it type of organization that's willing to say, let's bust this thing up. Let's see what we can do differently. Let's talk about nursing value and contribution differently. Let's measure that differently. And let's understand the outcomes related to that. Let's apply nursing process to healthcare finance, basically, and see what we can do and create the next radical transformation in healthcare.
Oh, yes.
Okay. I love it.
Amen.
So, Barb, if anyone wanted to connect with you after listening to this today, where is it best for them to do that?
Yeah, you can find me on LinkedIn, Dr. Barbara Seymour. I'm happy to respond to any messages there, or, be sure to follow me in the work that we're getting to do.
I want to thank you so much for coming and sharing your views on the healthcare rule breakers. It was a pleasure having a combo with you today.
Thanks
Yes.
a lot.
Welcome to the Rule Bakers Club, and thank you for what you're doing out there.
Thank you.